Hello, everybody, and welcome back to the Malaria Dialogues. This is before in the lead up to the Malaria World Congress, which is happening in Melbourne in July. And today we're going to be talking about a theme, putting people at the centre, engagement of communities and civil society in the malaria response. And we're lucky enough today to be talking to Dr. Khuất Oanh, who is the Executive Director of the Center for Supporting Community Development Initiatives in Vietnam. And one works at the interface between she's a medical doctor, but she now works at the kind of interface of the medical community, community-based organizations in the health response and in health systems. So welcome, Oanh, and thank you very much for joining us today.
Thank you, team. Hello, everyone.
I can see it's very local background behind you. You're in Vietnam,
Yeah,
right?
I'm in Vietnam, in the countryside of Vietnam. You can see vegetation and bamboo at my back.
Right. I'm not in Vietnam, so I'm speaking to you from the UK.
I can tell.
Yeah. So we're going to be talking about putting people at the center of the malaria response. But let's just start off by talking about kind of recent history with malaria. The World Malaria Report last year kind of was a bit of a wake-up call for people, saying that, after 15 years of success, the response to malaria is stalling. Would you say we're at an encouraging or a vulnerable point in the response to malaria?
People often say we are in the last miles of the malaria response. I think so. We have gone really, really far. We have reduced significantly the number of new cases of malaria and the death due to malaria. But the business is far from finished. And when we talk about the last miles, we often talk about the fatigue. People are tired, exhausted after a long battle, a long run. And we just have a little bit more to go before we finish. But the last mile seems to be the most difficult miles. But I think we should also talk, people use other image, is the low-hanging fruits and high-hanging fruits. So we can tell that we have done the easier path of malaria control. What has left for us to do are probably the most difficult part, the most challenging part. So if we are to finish the last mile, if we are to eliminate malaria, we need to try really hard now. We need to use a different approach. We cannot do business as usual. We cannot just do as we did before. We can also not just do more of the same thing. We need to do it differently.
Right. So it sounds like you see it as kind of a encouraging possibility, but also that we're at a vulnerable point as well.
Yeah.
Well, you're from Vietnam, as we said in the introduction, and one of the countries in the Greater Mekong sub-region where there is a lot of attention at the moment about malaria because of the emergence of drug-resistant forms of the disease. And we hear a lot about global reports and strategies and what's happening globally, but I just want to ask you, what do you see locally within Vietnam in relation to malaria?
Yeah, I interacted with malaria the first time 25 years ago when I just finished medical school and started my first primary healthcare project. So when we went to that mountainous area of Vietnam and asked the local people about their health concern, malaria came first. So, and since then, everywhere I went in the mountainous, in the border area of Vietnam, malaria was the first public health concern and the first health concern of the local population. And after a while, it seemed like malaria has decreased significantly. And since I moved to work on something else, I still pay attention to malaria, but didn't hear much about malaria and heard that, oh, okay, malaria no more. We don't have to worry much about malaria. Until recently, last 4 or 5 years, the civil society in Asia Pacific start to get together and to voice the concern about the malaria in the region. And then I said, okay, is it true? Is it true that malaria is still a big problem and we need to really work on it? I had doubt. But then I did a field visit to the area in Vietnam where we was told that malaria is still there. When I got there, I was concerned, seriously.
Yeah.
And my concern was not the same as 25 years ago when in my first field trip, my first community health project. It's 25 years ago, everybody worried about malaria. Now when I went there, people just consider a normal part of life. The local people asked, did you have a lot of mosquito when you went to the forest? A guy said, oh yeah, there's a lot of mosquito. There are more my legs than my hair, the hair of the legs. So the way they compare the number of mosquitoes. Then I asked, so about that, did you bring the net? He said, oh no, we don't bother. And then I asked, then do people have malaria? Yes, we have a lot of malaria. Almost everybody who went to the forest came back with malaria. People stay in the village, don't have malaria, but everybody went to the forest, had malaria. But then they just consider as normal. It's a normal part of life. In other village, when I asked about bed net, using bed net, they said, oh, if we carry the hammock net, it's very heavy. So I said, so what did you do? How could you sleep with the mosquito? He said, oh, it just brings a rice liquor and we drink and we drunk and then we forgot about the mosquito and we slept. So that's really concerned me. And a lot of people had malaria, but they just consider it as normal. And nobody talk about malaria elimination. So people see it, local people see it as a part of life. Nobody, the malaria elimination agenda that we talk loud and clear at the global and national level don't come to the local level. The very people who had malaria have no idea about malaria elimination. It has not become their own agenda. It has not become their own concern. So that concerned me a lot. And at that point, I said to myself, okay, now we need to work on this. Because in Vietnam, so far, the malaria response have been largely, mainly government program. The program have made a huge achievement. The number of cases of malaria have gone down significantly. But now we have around 40% of the case are malaria drug resistant. So that's concerning. And in some district where we visited, the number of cases went down, but then up again, and down again, and up again. And when I asked the local malaria program staff, do you think that it will go down and continue to down and down? They said, oh, we cannot say, because some year is down and the next year is up. We can never
Right.
say that it's
Right.
we are going to eliminate it.
Right.
So yeah, so that is the local picture.
Right. Well, it sounds, I can imagine from a kind of a well, just listening to you, it sounds like this is related closely to issues of coverage. I mean, you're talking about kind of forest people working in forests and kind of fairly kind of marginal communities, which are exactly the people that are not reached by health systems anyway. And that's what I think you're seeing. What you're seeing. Is there a kind of then a close relationship between malaria elimination and our goals, and kind of those broader access challenges, or the notion of universal health coverage and so on? They're all very closely connected by the sound of things.
Absolutely. I think here there are two issues. Number one is that the people who are most at risk of malaria, in particular in our region, our greater Mekong sub-region, are the people who are not usually reached by the government health system, because some of them, or many of them, have illegal activity, like the forest goer, where you are not supposed to enter the forest because the forests are protected, or the people who cross the border illegally. So we are very close to each other, and people cross border from Vietnam to Cambodia, from Cambodia to Thailand, etc. So these people, they try to avoid the government. Even the government health staff, they try to avoid, because they consider themselves as illegal. So that is one thing. The other thing is that they have not been organized as a community, and they have not adopt malaria elimination as their own agenda. So just to give an example of the illegal community, like a sex worker. So a sex work is illegal in all countries in our region, but because of a lot of effort, now the sex worker community really embrace the HIV prevention agenda. They would not have sex without a condom, for example. So that is an example. So we want to see, we need to see the same movement in the community of the people most affected by malaria in the region, and it is not there yet. Right. So talking about the health and malaria, or universal health coverage and malaria, we can see that we cannot separate that. And I have seen example quite striking. I was in a village, and a woman shivering with malaria. I mean, we can tell, we don't need to do a test on the symptom, are so typical of malaria. And I asked her, why don't you go to the health center to get tested and get treatment? And she said, oh, my health insurance card has expired, and I haven't got a new one. So if I go to the health center for a test, for a blood test, and it turned negative, I will need to pay. If it is positive, if she is confirmed with malaria, she will get everything free. So she doesn't need to pay for the test, she doesn't need to pay for the medicine. But if she's, and she has a health insurance card. So, but if she's test negative, and because the health insurance card has expired, she cannot use it for other medical conditions. So she would need to have to pay. So that's why she didn't go. And my team also met with a lot of mobile people who move from one province to another province to do farming, and they carry with them a box of medicine, a box of medication. So they just self-medicate themselves for whatever problem, because if they go to the health services, they would have to pay. And so we can see that we cannot separate malaria from other health issues. They are intertwined. They are very, very connected. And if the malaria, on the other hand, if the malaria program work well and able to reach those hard to reach population, we be able to reach them with other health services as well, not only malaria. So there's a challenge and opportunity here at the same time. And if we can have that lens when we do malaria, I think the benefit will be, the gain will be much larger than malaria.
Right. You mentioned that this is not the not on the kind of local agenda of affected people and local communities. I wonder if you could say a bit more about what you think is needed, whether it's leadership, whether it's just getting organized into groups, and whether there are lessons. I guess you mentioned one already, but there must be lessons from the HIV response that we can learn. It's like history repeating itself, isn't it? I mean, what do you think are some of the priorities for getting this onto the local community kind of civil society agenda?
I think we have for too long we have always considered malaria as a purely medical issue. That can be dealt with medication and at some extent the bed net. So you put people under the net, you give them the medication, or you make the test available, then that's done. But it is not that simple. Similarly for HIV, if you just think that, okay, so if we make the test available, if we make the ARV available, if we make the condom available, then we deal with HIV. The history has proven that it's not true. You can have a ton of condom, you can have the full warehouse of medication and tests, but if the community don't participate, then you don't control HIV. So I think what's really missing here is community leadership. In the Greater Mekong sub-region so far, it's still difficult for us to have community representative, to find people who represent the community is still difficult. We have NGO people like myself or a number of other people who are who try to be active and try to involve, but the community have not been there, have not been to be as active as and as engaged as in HIV response. So I think we need to do more. We need certainly to encourage the community and support the community to have to take their leadership in this malaria response.
What do you think are some of those things that we need to do? We've got and is this something that needs to be done at a local level, or are there things that need to be done at a regional or a national level to encourage this? I mean, we're talking ahead of this Malaria Congress, right? The Malaria World Congress coming up in Melbourne. Is that an event that could be a tipping point for this kind of civil society engagement, or making it more important? Where do you think action is most important to improve that?
I think we need that. We need at all level. First of all, it is the awareness. People need to be aware of the importance of civil society and community engagement. It should not be tokenistic. It should not be just to tick the box, because we have to tick the box that community is invited to the meeting, or a member of the CCM or this committee or that committee. So it's not just to tick the box. The community need to be really engaged, and if at all level people are aware of that, a genuine, a meaningful community engagement is needed, then we will work together to make that happen. When I went for the field trip to the malaria endemic area in Vietnam, I met with people in the community that most affected by malaria. They are ready to engage. They are there. They have a lot of wisdom. They have not a lot of knowledge and know-how and the commitment. The thing is that they need some encouragement, support, and organization to be able to have a collective voice, have a representative voice. So I think if people at all level are aware of that and work together to create the condition for that to happen, then we will have a hope. I really hope that this Malaria Congress will be the tipping point, will be the moment, always say the defining moment, where everybody agree that community engagement is the key for malaria elimination. And then we can discuss together how to make that happen. Of course, local context is different from one place to another place. We cannot have one formula for everyone, but there's one formula for everyone. It is the community engagement in malaria response. That one is a must, is universal, and I don't think we can do that. We can eliminate malaria without it. As long as the community don't think it is their problem, their issue, their concern. I don't think we can push people to sleep under the net. We can carry people to for malaria testing. We cannot put the pill in the mouth of people. So they have to be a part of it.
Right. I get the impression that the Congress is kind of, and its kind of rationale for the Congress largely is kind of bringing together different sectors, and they think of it. I think we tend to think of it in terms of scientists and the private sector and policy people and government, and so on. Just when we're talking about civil society, we've talked largely about local communities, but how do you think of civil society more broadly, or are you thinking very specifically about kind of meaningful involvement of local communities and affected communities, or do you think of it more broadly?
I think we need everyone. As the people said, it takes a village. We need everyone, but we clearly community need to be the center of it. And when I talk so I often say civil society and community, just to emphasize that we need community in it. Community need to be in the leadership role, need to be at the center of the response. And then civil society together with NGOs, different network, different professional organization, etc. So I think we need everyone, but clearly community need to be at the center. Other civil society organization need to be together with them to help to do capacity strengthening, to help them at the beginning, to organize, to help them to negotiate the space, etc. So to work together. It is not either or. It's not like a NGO or community, or private sector or government. It is together. Everyone have their own strength and have their contribution, their unique contribution,
right.
and we need to work together.
That's really clear. That's coming across very clearly in talking to you. I mean, some of the targets we've set for malaria elimination are fairly short term. They're quite ambitious, and we don't have, we don't have 20 years, the opportunity of years and years to get all of this organized. I mean, over the next year or two, how do you think we'll know whether this is working, whether we really are engaging communities and civil society? So, later this year, next year, what signs will you be looking for that this is actually happening?
We are lucky in a way because we have gone through 30 years of HIV response. We have experience in working with the community, having the community taking the leadership role. We have, if the community of people who use drugs, the sex worker, the gay men, the transgender people, the people living with HIV, the people who are most stigmatized and even criminalized can take the leadership and can drive the epidemic out, then the community most affected in malaria can certainly do that. We have a lot of experience already. Often people will say, oh, but HIV is usually it's in the city, malaria in the border area, in the forest. Yeah, sure, there's that difference. But people are people, human are human. There's a lot of similarity among these communities. And we have learned great here from HIV response. So we can use the experience of HIV response in working in malaria. A few years, of course, it's a short time, but I think we can be optimistic if we are determined and we are committed and we do the right thing. So if in 2 years we see the community people speaking at the national, at the regional, at the global level, I think it's a positive sign. If one day the people who represent the non-governmental sector are speaking about malaria in Vietnam, it's not me, but somebody from the community most affected by malaria, that would be a positive side. That would be a way of success that we are hitting the right direction.
Right, really helping local communities find that collective voice.
Yeah. They are part of the program. They take the leadership role. They are not just the recipient of the program, not the one who are given the bed or who are given the test or given the pill, but they are the one who demand that and make that happen.
Right. Well, I'm sure this is going to be a big, significant part of the agenda at the Malaria World Congress in Melbourne. I know there are a couple of events planned. I think there is a speaker from civil society speaking in the opening ceremony, I think. So looking forward to hearing your and other people's contributions to that discussion in Melbourne. I think it's going to be very productive, and I hope it is a kind of a tipping point for these issues. So let's leave it there. Thank you very much. So. Yeah.
Thank you very much.
Thank you very much for talking to us today, Oanh. It's really interesting. I think you're raising some really important issues, and let's get ready to discuss them in Melbourne. Thank you very much.
Yeah, so that's my observation, and hope to hear from others in Melbourne and in this dialogue as well. Okay. Thank you, Tim.
Right. Thank you very much. Okay.